Good day, everyone. This is Dr. Yakub, Life Hospital. Today, we're going to be talking about the health condition specifically in women, and in this case, particularly in pregnant women. Hypertension in pregnancy. Now, hypertension in pregnancy is one of those leading causes of death among pregnant women after bleeding disorders. All over the world, we know there's this concept of maternal mortality, that is, women dying from pregnancy related issues. Now, apart from bleeding, hypertensive disorders are considered the second most common reason why women die from pregnancy and childbirth related conditions. So it's important we understand what it is. We look at what are the risk factors for it, how can we prevent it if possible. Now, there are two types of hypertension in pregnancy. One is what is called chronic hypertension. That is, the woman was already hypertensive before she conceived. And then there's a particular one that occurs in pregnancy itself, usually from the second half of pregnancy up until delivery, in fact, up to 6 weeks after delivery. That is called pregnancy induced hypertension. Now, both of them, as far as the woman's health is concerned, are dangerous to her, but more so also dangerous to the baby. Now, what are the risk factors for this hypertension? Family history. People who have individuals in their family, like fathers, mothers, sisters, siblings, who have had hypertension. This is a risk factor for the pregnant woman developing hypertension in pregnancy or even developing hypertension before pregnancy. Now, the other risk factor for hypertensive disease in pregnancy is obesity. If the woman was obese at the time she got pregnant, then there's a risk factor. There's a risk of her developing hypertension in pregnancy. If the woman already has a kidney condition before or when she got pregnant, there's a risk of her developing hypertension in pregnancy. Other things that can actually predispose a woman to hypertension in pregnancy is the presence of twins, triplets, and the rest of them. In other words, multiple pregnancy. And then extremes of age in the woman. Teenage age, if a woman got pregnant too early in life or very late in life, she also has risk factor for developing hypertension in pregnancy. Now, how do we identify hypertension in pregnancy? Of course, the woman by herself, you cannot identify whether or not you have hypertension. The best place is usually in the hospital where you do your antenatal care. Now, during your antenatal care, there are basic criteria for making diagnosis of this condition. And once it is diagnosed, usually the hospital or healthcare givers know what to do to manage. But one thing for sure is once they pick hypertension in pregnancy, that woman, that pregnant woman, will be considered a high risk pregnant woman. And therefore, the management of the woman will be slightly more intensive as compared to the lady who does not have hypertension in pregnancy. Is there a way to prevent it? Yes and no. Now, for hypertension that comes up during pregnancy, to a very large extent, you may not be able to. In fact, a lot of times there's no clear-cut reasons why some women develop it and some women don't. And so it may be difficult to actually specifically prevent it from happening. However, there are things that can be done before the woman gets pregnant that may reduce her risk of developing hypertension in pregnancy, including weight loss. Okay, it's important that by the time a woman gets pregnant, her weight should be less than 90 kg. Usually, we have a less risk. Now, there are things that may be given to the woman that will reduce the risk of complications associated with this hypertension in pregnancy. This, however, do not entirely prevent the disease because it is known that the reason for the disease, or it is postulated that the reason for the disease coming in the first place, especially that one that is induced by blood pressure, by pregnancy, is because of the presence of placenta. Okay, and since or as long as the placenta is in her, then you may not be able to entirely prevent it from happening. However, having identified it, then there are a series of modalities, most of things that can be done to prevent complications that may occur during or immediately after pregnancy. So, by and large, hypertension in pregnancy is actually a very devastating situation, especially when it comes in the severe form or when it comes with complications. And it is very necessary that every pregnant woman, especially pregnant women who have risk factors for developing these things, the extremes of age, family history of hypertension, diabetes, multiple pregnancy, and the rest of them, you should not manage yourself at home. You should go for antenatal care in centers that have the facilities to manage you when and if you develop that situation. That way, you'll be saving your life and you'll be saving the life of your unborn child. Thank you.